If you have knee pain and you're still doing these 5 exercises, you're making it worse, not better. Most people spend months trying to push through the discomfort, assuming that movement will eventually fix the problem. But when the wrong movement is the problem, more of it only digs the hole deeper. Most people never figure out why their knee pain isn't going away. Today, I'm going to show you exactly what's happening and what to do instead. Why your knee pain won't go away. Here's what most doctors don't tell you. Your knee pain is rarely just a knee problem. The hip controls knee alignment. Every time you take a step, your hip muscles are responsible for keeping your knee tracking in the right direction. When those muscles are weak or underactive, that load doesn't disappear. It transfers directly to the knee joint. The knee ends up absorbing forces it was never designed to handle alone. When you do the wrong exercises on top of that, you're adding stress to an already inflamed joint. That's not a path toward recovery. That's a cycle. And today, we're going to break it. Exercise number 1, deep squats. The squat is not inherently a bad exercise, but depth matters significantly when the knee is already irritated. When you descend into a deep squat, the patella, your kneecap, is driven hard against the femur, the bone beneath it. The compressive force on that joint increases dramatically the lower you go. For a healthy knee, that's manageable. For an inflamed or arthritic knee, that repeated compression can aggravate the joint lining, worsen cartilage wear, and increase pain both during and after the movement. This one particularly affects people over 50 and anyone dealing with patellofemoral syndrome or knee arthritis. The deeper the squat, the more the kneecap pays for it. Exercise number 2, leg extensions. Machine. The leg extension machine looks straightforward. You sit down, you extend your leg, you feel your quad working. On the surface, it seems like a safe, controlled movement. But what's happening at the knee joint tells a different story. As the leg straightens against resistance, the tibia, the lower leg bone, is pulled forward relative to the femur. That movement creates what's called shear force across the knee. Specifically, it places significant stress on the ACL and the meniscus, the structures responsible for knee stability and shock absorption. For people who already have meniscus damage, ACL history, or any degenerative joint changes, which is common in adults over 50. This exercise can provoke pain and accelerate wear. It isolates the quad without the protective co-contraction of the surrounding muscles that happens in functional movements. Exercise number 3, running on hard surfaces. Running is not the enemy, but the surface you run on matters more than most people realize. Every time your foot strikes concrete or asphalt, a force roughly 2 to 3 times your body weight travels up through the ankle, the knee, and into the hip. Softer surfaces, grass, packed dirt, a proper running track, absorb a meaningful portion of that impact. Hard surfaces absorb almost none of it. For someone with healthy knees and strong supporting musculature, the body can adapt to that over time. For someone already dealing with knee pain, particularly cartilage thinning, bursitis, or IT band issues, that repetitive impact with no shock absorption is a consistent source of re-irritation. The knee never fully settles between sessions because it's never fully allowed to. Exercise number 4, high-impact lunges. The lunge is a valuable movement pattern in the right context, with the right form for the right person. But the high-impact variation, stepping forward aggressively, dropping the back knee quickly, or adding a jump, introduces a problem that's easy to miss. When the lunge is performed with speed or without careful attention to alignment, the front knee frequently collapses inward or drives forward well past the toes. Both of these positions place the knee in a mechanically compromised state. The joint is absorbing load in a direction it isn't built to handle efficiently. For older adults, or anyone with existing knee instability, this misalignment during a loaded, high-impact movement is a reliable way to aggravate the joint. It's not the lunge itself. It's the speed, the load, and the alignment breaking down together. Exercise number 5, straight leg deadlifts, heavy. The straight leg deadlift is a hamstring-dominant movement, and the hamstrings attach just below the knee, at the top of the lower leg. When those muscles are already chronically tight, which is something we commonly see in people who sit for extended hours, loading them heavily through a full range of motion creates a strong pulling force directly at that attachment point. Over time, or in a single session if the load is too high, that tension contributes to pain at the back of the knee and can aggravate conditions like hamstring tendinopathy or posterior knee irritation. This doesn't mean deadlifts are off the table permanently. It means that heavy loading through a stiff, tight posterior chain without adequate preparation and mobility, is a setup for knee strain rather than knee strength. What to do? Instead of those 5, shift your focus to 2 things: hip strengthening and low-impact movement. Here are 3 exercises worth starting with. Clamshells. Lying on your side, knees bent, feet together. You simply rotate the top knee upward like a clamshell opening. It sounds almost too simple, but this movement directly activates the gluteus medius, the hip muscle most responsible for controlling knee alignment. Strengthening it takes load off the knee without placing any stress on the joint itself. It's appropriate for nearly all fitness levels and ages. Wall sits. Shallow 30 degrees. Not a deep wall sit, a shallow one. Back against the wall, knees bent only slightly, around 30 degrees. At this range, the quad is working, the knee is not under significant compressive load, and the joint is in a position it handles well. Hold for 20 to 30 seconds. Build from there. This builds the quad strength necessary to support the knee without the strain that comes from deeper positions. Seated heel slides. Sitting in a chair or lying on your back, you simply slide the heels slowly toward you, bending the knee gently, then slide it back out. This creates controlled range of motion, keeping the joint moving, encouraging fluid circulation, and preventing stiffness without any weight-bearing load. It's one of the safest options available, particularly for seniors or anyone in a pain flare. How we can help. If your knee pain has been going on for more than 3 months, and you've been exercising, resting, and still not seeing improvement, it's time to get it looked at properly. A knee that keeps hurting is giving you consistent information. The question is whether the right person has had the chance to interpret it. We help patients all across Texas find relief without surgery. Call us for more information or visit our website, schedule a consultation. We'll take the time to understand what's actually driving your pain and build a plan around that. And if this video was useful to you, hit subscribe. We post new videos every week on pain relief you can actually use, explained clearly without the noise. We'll see you in the next one.